So this is the explanation and anatomy video for hip locks up and down. So we'll go over some of the important postural points and things to watch out for as far as safety and comfort, and then the anatomy of the hip locks. So first things first, hip locks look like this. Now, a couple things to watch out for due to the fact that one of the primary muscles involved in this is the quadratus lumborum, which is on either side of the spine and attaches from the ribs to the hips. It can have a tendency to pull your butt out and crunch your spine. So to combat that, we want to make sure that we engage in the front abdominals, so the rectus abdominis and the transversus abdominis, to make sure that we keep that back nice and long. Another important point is the knees. The knees need to be slightly bent, but not squatted down, because that's going to be a lot of pressure on your knees to hold for a long time. But if they're straight, your hips aren't going anywhere, so you can't really move them. So just a little bit. And the closer together your feet are, the more range of motion you'll have in your hips. Because if you spread your feet apart, like I can still do this, but it doesn't look as big, right? So it's not exactly a range of motion issue as much as a visual one. So visually, this looks bigger if my feet are closer together. So the primary muscles involved in this, there are three. There's the quadratus lumborum, or the QL as it's commonly known, the exterior obliques, and the interior obliques. So the quadratus lumborum, which I already pointed out on my body, looks like this. And these cards are from Trail Guide to the Body flashcard set, if you want your own. So this is the QL here, and it's on both sides, and this is the back view. So it goes from the top of the ilium, or the hip, to the low ribs, and you can see on the front too. So it literally brings, if you're holding your rib cage still, which you are in the hip locks up and down, then it brings your hips to your ribs. And then we have the external obliques, like this. So as you can see, the fibers of the external obliques come out to in as they go down. So they go this way. So if you're doing a hip up, think about here to here is coming together. So that would tend to pull your rib down, but since you're holding your rib steady, instead it pulls the hip toward the rib. And then the internal obliques, like this. See, they're a little smaller and they're underneath the external obliques, and their fibers go the opposite direction. So internal obliques come this way. So the internal obliques are the ones I really like to think about when I do this movement because of the aesthetic they give you. So think about it from here to here, pulling. So the internal obliques especially, and to some degree the external obliques, can, instead of just pulling up and down, it can pull your hips in a little bit, which gives it a slightly different look. And I recommend trying to practice thinking just up, down, and sometimes thinking in a little bit, because at different times when you're dancing, you'll want to have those different aesthetics. So it's nice to drill both. And another note on the anatomy and technique of this is I really like to think about most of the work being in my obliques and not in the quadratus lumborum, because even though the quadratus lumborum is a primary mover, if I think more about my obliques, for me that tends to take pressure off my back, because I'm thinking about the work coming from the front. So I'm not going to tend to crunch and stick out as much. And it should feel like a little bit of an ab workout, especially if it's new to you or if you're drilling it for a long time. If you start to feel tension in your low back, go ahead and stop for a second. Do a little stretch. I'll show you a couple stretches in a second here. And then re-engage all of the abdominal muscles and then try again. And it's so important to make sure that you're listening to your body and really feeling how the movement feels in your body, because it's just so much more pleasant and comfortable to dance in a way that doesn't pinch or compress your joints. So a couple of stretches, if you're starting to feel it in your low back, are what I have heard called standing cat-cow. So you come in like this, and you're just thinking about lengthening your entire spine from the base of your neck all the way down to where you come to your sacrum, that fused bony bit on the bottom of your spine. And then when you do this part, make sure you're thinking about the top of your head and the bottom of your sacrum or your sits bones or tailbone going as far away from each other as possible, and you're engaging these abdominal muscles a lot. And you can inhale here and exhale here if you like that. I sometimes like to stay here for a bit, and I sort of rock my hips back and forth, because I find that that helps me feel it feels like at least, I'm helping stretch each individual quadratus lumborum. So it really helps stretch out after a lot of hip work. And then another option is to go all the way into a forward fold. So we'll bring the camera down here. Let's see. So down here, and when you bend your knees, you're going to get more of a stretch in your low back. And make sure all the time when you're doing this, you're really feeling the weight of your head. Don't like bring your head up like this, because then you're not giving yourself that full stretch across your entire spine. And you can let everything hang. And obviously there will be different degrees of flexibility for this. And you might feel better just doing the standing cat-cow. And then if you straighten your legs more, you're going to feel your hamstrings on the back of your legs more. And if you really want to feel those hamstrings, think of reaching your sits bones to the ceiling. That'll really stretch them out, because the hamstrings also get tight when you're in that constant bent knee position. And you can go back and forth between bent and straight, or you can do one knee at a time, and that'll sometimes give you a stretch along the sides of the legs. And you can come up either rolling up or with a flat back. So that's the foundations and anatomy for the hip up.